We have Morgan Jeffries with us, who is a neurohospitalist and a medical director for AI at Geisinger, where his primary work involves implementing AI at scale across the health systems.
I just kind of want to frame the problem for us all. So, and I apologize. This is a slide deck that I presented internally to our AI executive steering committee, and I think I've removed things that are really specific to us that you wouldn't care about, but there might be some things that have slipped through. So, yeah. So, okay. So, going to talk to you today about AI education and workforce safety. So, and maybe before I even get into this slide, I can talk kind of about some general setting up. No, I'll go ahead and get into this. So some general AI safety risks that you might encounter are on this slide. Now, I don't know how many of you are familiar with these, but I certainly feel like our workforce writ large is not. Some of them are, I mean, bias is a pretty broad topic. Anybody, do you guys know dialectic bias? Is that one you're familiar with? Anyone? Dialectic bias is the tendency for LLMs, they may reject sort of explicit notions of bias. Um, they can be induced to behave in a biased manner by the use of different dialects. So there's some research on this where, exposed to, language written, one way, that'll sort of say like, it'll make basically different judgments about the speaker depending on the way that they write things. Um, and it's the kind of thing that it could pick up during its pre-training, and then you might imagine it's a little bit harder to fine-tune that kind of behavior out. Um, Automated discrimination, anyone know that one? It's when you have bias you have sort of bias in a system, and then because you build an AI model that's trained on the data that you got from that system, you then end up automating that process. So a good example of this would be that model that Optum built for uh, determining, trying to figure out like patients who are going to be high utilizers of care so that they could get extra resources. And because of the data that was trained on, it basically Black people in the sample were underutilizing healthcare relative to white people, and the reasons for that are probably complex. Um, but the problem is that this was now making recommendations about who actually needed extra resources to avoid increased utilization in the near future, and so it ends up under recommending care for Black people compared to white people who, by other measures, are at least, have at least as many health problems. That's an example of automated discrimination. So obviously, I'm not going to go through all of these, but these are some risks that you encounter when you're dealing with AI. And you are all interested in this, and probably some of these terms are unfamiliar to you. So you can imagine that the general user is not going to know a lot of these things. And this is something that we started to realize was becoming a problem for us. So how? Well, there are kind of two areas where we saw this. One was at the level of individual users. So we have a governance framework that we've set up at Geisinger. So essentially, we have a policy that says if an AI system has posed a significant risk to patients, members for the insurance, employees, or learners, then there are certain things that the program is required to do. They're required to do an assessment of possible harm. They're required to do an equity assessment, and they're required to implement to plan for a monitoring program, and then to have it, or they have to have a monitoring plan, and then they have to have an escalation plan. So how are we going to find out if something's going wrong? And then what are we going to do if something does go wrong? Like, do we just shut it down? Is there someone we should notify, et cetera? And so, we started this basically last fall, and we're changing this now. But the way that this has worked is that essentially, like, these programs will come in front of us, and or the programs will come through the pipeline. And initially, it was the program owner had to fill out some questionnaire that basically explained what the system was, potential harms, et cetera. And we found that they were answering things like we were getting a lot of answers that, or one, they didn't really explain the system very well. And then two, for potential harms or potential harms to specific groups, they would answer NA. They just didn't really have a good sense of like how things could go wrong. So we changed that to be more of a one-on-one discovery process with them. So instead of them filling out a questionnaire and that comes to in front of the committee, we had somebody from the team kind of work with them, interview them, and try to get this information out. But even then, it was really a struggle to try and get good answers from them. They seem systematically, they don't seem to understand the risks that we're worried about. How a system could cause harm. Like there's I think, widely held sentiment that human in the loop is sufficient. And there are definitely times, if you go through, if you see like a bunch of notes generated by AI that are of high quality, it's just like looking at a bunch of notes from residents that are of high quality. I mean, you start to pay less attention and, stop reading through it with a fine-tooth comb because it's like, yeah, they know what they're doing. But AI can fail randomly, so that doesn't necessarily hold there. And so there's certainly a risk that something slips through. But that's not something that people broadly appreciate. The other thing was that, or another big issue is that the program owners viewed this process as being really onerous for them and kind of pointless, like it was paperwork, um, and not really having an appreciation for how badly things could go wrong, and how that could affect not just an individual who's harmed, but also could be a big problem for the system as a whole. I mean, if you have a system drafting messages to patients and it puts in some bad medical advice and someone sends that out and there's harm caused to the patient as a result of that, it's very hard, I think, at that point for you to, I mean, that's the kind of thing that gets picked up. And if there's, especially if there's like a lawsuit involved, and it's very hard for you to be perceived as a leader in AI at that point. Um, and so, we're trying to get people to appreciate these things, but it's been a challenge thus far. Um, so the other thing that we realized is that at the level of individual users, these programs, part of what we want to do is try to put up guardrails around, some of the AI tools that we're giving to our users. But we started to realize two things. One is that it's very difficult in some cases to put up additional guardrails. So as an example, we have an AI assistant that's available for our users. AI assistants, by the way, if you're not familiar with that term, that's like ChatGPT, Claude, Gemini. They're just, general purpose helper tools built on top of an LLM. And we have one that's available for our users, and it's because of the way that data is handled there, we can't like see individual user chats. So there's no way for us to monitor those chats in any way. So we can't tell if there's something harmful being generated by this thing. It's also the something harmful depends a lot on context. If I, as a neurologist, ask a question of a system of an AI assistant, if I ask it about something neurological and it tells me something that's not correct, presumably I will be able to pick that out. But if an administrative assistant working in our department is asking questions about, her severe headaches, and it's giving her bad advice, then that is potentially harmful. So, it would need to have like some additional context besides just like the conversation. It's got to know like who the person is. And for a variety of reasons, it's not really practical to monitor things in this way, and in some cases not possible. But so we can't put up guardrails on everything, but we also started to realize, look, even in the real world, literal guardrails don't prevent you from killing yourself in your car. There's an expectation that people that are on the road know how to drive. That they're licensed, they've gone through some kind of like, driver education, and they've passed a licensing exam for driving. And I know there are some very bad drivers out there, but they still understand like this is how the steering wheel works, and this is the gas pedal and the brake. I mean, some basic level of competency. And so we started to realize we need to have that same level. We need to be able to guarantee that same basic level of competency in our users. So what we came up with was a plan to develop 2 courses, which are a general AI safety course, which I'll talk about the contents in a second, and then that would be for all users, and then an AI stewardship course, which is going to be for program owners. And then we would make additional materials available that are, cover broader areas. I mean, there are lots of things outside of what we would cover, like in these required courses, that we might like for people to know. This is not going to be, it's a required course. So, I mean, there's only so much that we can really push on people, and there's a lot to know about AI, but we do want to kind of curate materials so that our users who are interested can take a little bit of a deeper dive. So what we would include in this, and these are just sort of candidate topics that, threw together. I think that these would probably overlap with what would actually go on the course, but there's probably some stuff that would go on a course like this that's not going to be listed here, and vice versa. So an overview of AI, talking about the different types of AI systems and some of their limitations, a discussion of AI errors, different types of errors that can occur, and how you might validate responses that you get out of AI for those different error types. Discussion of human AI interactions, like what leads people to be fooled. So, for example, understanding the concept of confirmation bias, which is where you go and seek out information that confirms pre-existing beliefs, but also how that interplays with sycophancy coming from the AI assistants, where the way that you frame your question, they want to please you. Well, I don't want to anthropomorphize too much, but they've been, through their training, been taught that they get rewarded basically for providing answers that people like, and people tend to like when something agrees with them. So it sort of drives them towards this behavior of presenting things that are tailored to the way that you ask a question. And so understanding that kind of dynamic and how that can lead you, to that can reinforce that confirmation bias, and how if it's something important where you need to consider alternative points of view, that you really need to keep that in mind, and maybe even go out of your way to ask it to give you evidence to the contrary. Like, I think this, but hey, maybe give me some pushback on this. And then a concept, basic concepts of security, about how to handle sensitive information and untrusted documents. And then for the AI stewardship course, probably a deeper dive on bias and fairness, discussing how systems can fail with concrete examples. That's very important, because I think a lot of times this stuff is sort of theoretical, and it really helps if you can give examples of, like, here's a system. How do you think this going to do? Can you see any problems here? And then, well, here's how it failed. Brief discussion of the regulatory landscape. Not too deep on that, but we have had some misconceptions there. Like, for example, we've had people object that a tool was FDA approved, and therefore didn't need oversight, which is, by the way, not the FDA's position. And then how to work with AI safety teams. How to identify risks, monitoring, escalation. And yeah, so we've been I've reached out to several different groups. We work with HAIP, the Healthcare AI Partnership, and we've had some conversations with them and talked to some external organizations through them about how to do this. I've also reached out through professional networks. I think I posted about this on LinkedIn and got a lot of responses. It seems to be a topic that people are pretty interested in. And then, we'll be working to define our curriculum, and then based on that, kind of, once we have kind of a framework in place, kind of flesh that out, and then would implement that in our learning management system. Cool. So I would I just want to be clear, if it wasn't obvious from that, I'm in no way an expert on this. This is just something where we have started to recognize it, and we're looking for, ideas from other people. So I'd love to hear what you all have to say about this.
And with that, do you want to just use the Zoom hand raise for making a queue of questions? Mike, go ahead, please.
Sure. And I remembered from yesterday where the button was.
Yeah, Mike went like this, and I was like, no, no, I might zoom in this. So
So, great conversation here, by the way, Morgan, and not something that, as a technologist, I didn't really think about the application to healthcare so far, and my day to day, I'm thinking more about it in coding productivity, right, which is a very different application. But you opened my eyes to some serious dangers. I'd have to say that, in the healthcare world that have to be there. And obviously, the cat is out of the bag. I don't know that you can stop from using AI in the healthcare world, but with all the guardrails you're starting to put in place, and with the real risks and education you're doing, or is there actually benefit at this point, or is it actually a drag on the system?
Benefit from AI or
Yeah. I mean, some of the teams we talked yesterday about coding productivity uplift, and some of the teams on the lower sides only see 20 to 30% productivity uplift, and that's I'd say in an area where danger is low, right? You've a high danger area, so I'd have to imagine that the checks and balances cost more time, and therefore, is it an actual uplift on the system, or is it a drag?
Yeah, no, that's a really good question. So I would say one of the areas where education is so important is on like just making people aware of the risks. Because I think our group, as we've been looking at these things, we've started to realize there are tools that are out there already that like we don't have guardrails on, and they were kind of released, or at least started to be released or piloted before we built up this governance process. Um, and there's definitely we've definitely moved into a phase where there's this big top-down push, and also really, I mean, bottom up too. People are asking for these things to to move forward with AI, almost to the point. I mean, I find myself asking people a lot, like trying to push people a lot on like, so what are you hoping to accomplish with this? Like, what do you think the value is here? But I mean, like one of the biggest things that we rolled out early for generative AI was ambient listening. So since you don't work in healthcare, you may not realize this, but documentation is like this huge productivity burden. I mean, it's a lot of work to like type out your notes every day. Um, and this basically captures the conversation and generates a note from that, which I mean, there are definitely risks involved there, but for sure, it's a tool that people who have used it, especially like in the ambulatory space, like primary care, where they're seeing 30 patients a day. I mean, the encomiums coming in about this. Like people are just like, please never take this. This tool changed my life. Please don't take it away. So, and then we have in that case, we actually have some objective data that our users save like 2 minutes per note, which, over the course of the day, it adds up to, it's something like 45 minutes to an hour that people are saving total over the course of a day, and lower rates of burnout. So there's a lot of enthusiasm, I think, based on that. Now that we're starting to get more clinician-facing generative AI tools that we're rolling out, I think there's been such a push to get them out. People have been like less keen on, hey, like what maybe we should measure what we're trying to like, what's the business impact of this thing? And also, can we talk more about like what the risks are and how we would capture those? And I mean, I hear the phrase light touch of governance more than I would like. So yeah, I mean, it's not becoming a drag, partly because we're not doing as much of it as we probably should. I'm hoping that I'm hoping that we can socialize this enough that people start to realize how important it is, and we get more resources that we can dedicate to it, and that it's not because something actually happens and everybody suddenly realizes that like, oh yeah, we should definitely be monitoring things more closely. So, and I don't want to make it sound like we're cowboyish, but it's just
No, it's
I always
just
feel like we should
you
do
are.
more.
Yes.
Yeah.
Yeah, just the fact of where you are today. Yeah.
Yeah.
Thank you.
Yeah.
Adam and Randall, and then me too. I apparently don't, as the host, have a hand that I can raise. But Adam, over to you. Okay, Tayaru and then me.
Yeah, Morgan, I just wanted to mention, I definitely agree with you. I mean, the AI assistant thing, I think that's a great way to really look at these LLMs. That's really what they are. I think the key is assistant. There's definitely a lot of talk about expert and expertise and stuff, but I think, you have to be careful about, what really constitutes expert. Because, the deeper you get into something, the more likely LLMs are going to be less useful. But I mostly wanted to just make a comment that actually it is possible for you to monitor LLMs. It's definitely possible. It's just not easy, I don't think, for departments to do that. But it's certainly, I would imagine there's already startups or at least some of the enterprise networking monitoring companies building tools for that. But it is most definitely possible to monitor like traffic going to like ChatGPT, Cloud, Gemini, or whatever. So I just kind of wanted to add that.
Thank you, Adam. Randall, over to you.
Yeah, so thank you. I unfortunately missed the middle bit of the talk, so I'm gonna have to go back and watch the recording because I'm very curious about some of your takes on things. The question I wanted to ask you was internal versus external LLMs and other models. Do you see larger health systems and other organizations training models internally? Do they have that expertise? I mean, they have just an enormous wealth of data that they have access to. But do you see more folks training things internally, or is there an expectation that we'll look externally for various models and AI things to leverage for things like doctor's notes and other process and workflow productivity areas, whereas with medical interpretation, maybe imaging and or diagnostic types of things where you might look to external vendors for their models that are trained on data, or maybe training their models on your data. Like, can you talk a little bit about that
Yeah,
split?
I can
That makes sense.
keep this. Yeah, I can keep this brief. I think training our own foundation models. So like if it's training predictive AI, we do that. But if you're talking about training foundation models, I feel like that's a thing that's kind of flashy. And is something that was, there've been a couple of publications around that of like we train our own model, but yeah, I don't see that being probably a good investment of time and effort for most health systems. I think there might be smaller bespoke models that are built for healthcare, but probably it's going to make sense to do that like in coordination with like an external technology partner rather than like a hospital system to do that and then plug that into their own systems. Just like seems like a lot of effort to build and maintain something like that. It's definitely not something that we're planning on doing.
Got it. Okay. Thank you for that. I have
Yeah,
more
sure.
questions, but I'll let other folks go.
Tayaru, please.
Hi, yeah, this is a great talk. So my question is more generic. Like in the healthcare space, there are scenarios which are high risk, where the communication is going out to the patient with recommendation. And there are low risk, where the doctor, you are using AI to help or enhance doctors' efficiency. When you are putting the guardrails, are you looking at the scenarios? This is at a broader level. Are you looking at all the scenarios and then imposing the guardrails so that they're effective, or it's like general guardrails across the board?
No, I mean, I think to the extent that we're able to do it, first of all, I mean, like it's been, yeah, like it's been challenging to get the guardrails up, and like we're trying to do it with sort of like minimal resources. I mean, like we're working on one now for a summarization tool. That like Epic like has these inpatient and outpatient summarization tools. And I mean, I think we're going to end up for that relying probably on user feedback, which I feel like is not fantastic, but it's how there's been some work, but not like it's not like an established standard of like, okay, how do you say like how can you objectively score the quality of a summary of a medical summary? There's been like a little bit of work done with that, but if you wanted to, there's not like a clear best practice there, and if you wanted to implement that and then follow that over time, you know, it would take resources that I won't say that we don't have, but that we're using for other things right now. So, I mean, we could pull people off of projects to build that, but there are other things that people are prioritizing ahead of something like that right now. So yeah, but in general, yeah, I mean, it really depends on like the specific use case. I mean, the harm really depends on how the thing's being used.
Morgan, thank you so much.
Yeah, sure.
I think this is easily the one talk that had the most questions. I have not been able to get through to all questions till now. Thank you everyone else for joining, and I hope to continue the conversation on LinkedIn, and we're about to make a Slack connect. So Jericho, apologies for that, but thank you everyone. Have a great day.
Thank you.